Hello, my name is Patricia Santos-Serrao. I'm one of the Senior Product Managers here at MasterControl. Thank you for your time, and today I'd like to discuss with you a little bit about our MasterControl Regulatory Suite. As some of you may know, we have a number of solutions designed for the quality, regulatory, and clinical life sciences side of the business. And what we'd like to focus on today is showing a little bit more detail around what we offer for regulatory affairs and regulatory operations. So our regulatory suite is made up of a number of solutions that we've taken from a number of our modules that's integrated to give you a complete solution for regulatory affairs. So starting with the document management aspect, we have a module called MasterControl Documents, and what we've done is taken the DIA EDM reference model and configured all of its components into our Documents module. We also have a project module that will enable you to manage your Common Technical Documents, or eCTDs, within an organizer that will allow you to see the progress as each of your documents are progressing and being prepared for your eCTD submission. We also have a rendering engine, a PDF rendering engine, that will enable you to produce submission-ready PDFs to be utilized by a submission publishing tool to generate that final eCTD. We also have the ability to have a number of options with regards to integration with those publishing tools. The first is utilizing our export tool. Some customers decide that they want to keep the two systems separately, have the document component separate from the submission publishing component. And our gateway enables you to import and export bulk content in and out of the system, including the metadata that's associated with those documents. We also have what we call our APIs, which are connectors that allow you to integrate our document module to your preferred choice of submission publishing tools. Ultimately, once the submission output has been generated, you want to archive that final submission into a secured system. And we have what we call our submission lockers. And our submission lockers are an archive that allows you to store and save and back up your entire submission as a whole. But one of the unique things about our submission lockers is that, unlike some other EDMS systems, the hyperlinks that are created throughout the submission, whether it's the index XML file or any hyperlinks across documents, they are fully functional. So you don't lose any of that ability to navigate your entire submission the way a reviewer would through an eCTD viewer. So for starters, the Documents module comes with a number of the out-of-the-box functionality, things like the securities, version control, life cycles, routes, the ability to collaborate on documents with other users, administering electronic signatures are all part of the core functionality of our Documents module. Rules are also part of the pre-configured system that are part of the EDM reference model Jumpstart. Within that configuration, you will have all of the configuration that comes with the DIA EDM reference model for modules 1 through 5, the regional, the clinical, non-clinical, and quality aspects, as well as all of the summaries that are found in the module 2 of CTD or eCTD. Also out of the box comes all of the metadata that's mapped to each of those different types of or categories of documents. So for example, the metadata or fields that are assigned to info card types or document types such as regulatory are different from those of clinical. In clinical, you'll have a field such as study number, study phase, whereas in regulatory, you'll have things like region or regulatory authority or submission IND NDA number that you're assigning that cover letter or document that you're writing regionally for that particular submission. Also with the EDM reference model, you have the automated creation of those taxonomies. So as each document is being created, whether it's a regional document, a clinical document, they automatically are being inserted into a predefined folder structure that adheres to that EDM taxonomy, enabling your users to either search for documents using our search functionality, but also they can drill down the folder structure in a very logical way and locate the documents that they're looking for. Also, as part of the regulatory suite is our project module. And our project module is often referred to as our Microsoft project on steroids, meaning that unlike your standard project plan that has a task item that needs to regularly be updated with a new status, As each of those components and documents are being written, reviewed, collaborated on, and approved, the progress of the life cycle of each of those documents is being managed as tasks within MasterControl. So no more need to meet with a project team to get a status of how far along are you with this document, when do you anticipate getting this document to me, have you even started authoring it yet? You can see all of that project progress within the project module. So here's a visual example of what the configuration looks like within the EDM reference model. We have a number of what we call info card types, or high-level categories for documents, covering regions such as the US, Europe, and Canada. We have the different quality aspect of documents for drug substance, product, and other, the category of other, which encompasses the summaries as well as literature reference. We have clinical components of the configuration for clinical studies and clinical summaries, and also the non-clinical with regards to the pharmacology, toxicology, and ADME type study reports. Here's a visual also of our project plan of how it's displayed to a user, how they would manage a CTD. So in this example, we can see components of the Module 4 and Module 5 of a CTD, and you can see that you can assign people that are responsible for getting that document to you. Those are the responsible authors that when that time comes where that document is ready to be initiated, they will get a task within the system telling them, here's the document you need to write, the start date has approached, or the predecessor documents that needed to be written before you can start on yours have now been completed, and you can now start on your document. With that task reminder comes a template that can also be assigned so that they have very quick access to the document template they should be leveraging for creating that brand new document. And at any point in time, via access, they can go into the project plan, and if they want to be very proactive and start on documents that perhaps they're not yet needing to start yet because the due date hasn't arrived yet, they can proactively go into the system, click on that task, and have access to those templates and begin the work on that document. And you can see from the progress bar, you can also see how a document will make its way through its path. So as it's being reviewed, collaborated, and approved, you as the project owner can see what the progress is of your CTD and how close to completion you are, and which outstanding items are still out there being worked on and need to be completed. So here's a visual of how we've tried to address the different needs for the regulatory space. So with our documents module, we've provided you with a 21 CFR Part 11 compliant document management system with all of the life cycles, versions, roles, rights, access assigned to those, as well as the EDM configuration that then will be leveraged to be able to have the categories for those documents, the metadata, and the predefined routing and role assignments for that configuration. We also have the eCTD project template that will allow you to treat your eCTD compilation as a project and be able to see the progress as it's going through its completion of each of those individual documents that need to be authored. We also have that bulk import-export tool, which is our gateway that allows you to push content out of the system for use by a publishing tool, and ultimately use that same tool to bulk import in that final submission when that publishing tool has done its job. And then ultimately, our submission lockers will enable you to archive that final submission, and again, a very unique functionality that will enable you to store your final complete electronic submission, being able to leverage all of the hyperlinks, active bookmarks, index XML files, and navigate the entire submission as if it were sitting on a file system or being navigated using an eCTD viewer. And then last but not least, the publishing component, which will enable you to produce automatically submission-ready PDFs with all of those prerequisites that are found in the FDA and ICH guidelines for electronic submissions with regards to bookmarks, hyperlinks, inherit zoom, and all those bells and whistles that they require for your PDF output. So that concludes our preview of our regulatory suite. If you have any additional questions or would like to see a demo or receive more information about our regulatory suite, please feel free to contact one of our representatives. Thank you for your time.